Hi, I'm Dr. Mike Grady, Director of Clinical Affairs at LifeScan, and I'm going to cover today the study which looked at healthcare professional perceptions of the clinical value and utility of current blood glucose meters. Now, I'm going to first start by taking you through some clinical findings. Steve Edelman observed that around 50% of type 2 patients on insulin therapy regularly took no action for their out-of-range values. And this limited capacity to take decisions on results has also been seen in patients with type 1 diabetes, who also had limited knowledge about glucose targets. And also, despite significant increases in CGM usage, improved glycemic control has not always been forthcoming. And it does suggest that there is a fundamental lack of insight and action by some patients, and we really need to provide tools for them to be more successful. So let's have a little look at the guidance here. Self-monitoring, as we know, can support treatment decisions, and this is made clear in the diabetes guidelines, but visualizing BGM or even CGM data is challenging. Even with an ideal logbook, discovering patterns and trends can be difficult, perhaps even understanding which results happen to be high or even low. Now, there are many glucose meters available, but few have advanced features shown clinically to offer benefits to patients. And 3 of our meters, featuring colour range indication, pattern recognition, and motivational messages, have been shown to improve data interpretation and glycemic control. Now, our ColourSure technology has been evaluated in a number of studies, and I'm trying to show this panel here, a number of studies where we educated a cohort of patients on the ColourSure technology, just a short exposure, and then we demonstrated that when these patients were asked to classify results without anything more than the glucose value, they were very much better at placing results into glucose ranges just with that short exposure and interaction with this tool. Now, we took this further into a randomized controlled trial. We completed a randomized controlled trial to demonstrate the value of ColourSure and also some motivational messages within the variometer. And we found an almost 0.4% improvement versus a variety of other meters where patients made no improvement over 3 months in glycemic control. Our latest meter, the One-Touch Vario Reflect, builds on previous clinically proven features with even more insights. We have a blood sugar mentor, which provides guidance and helpful tips based on the patient's results. And I'm going to show you in the next slide a number of screens that can be provided to the patient. But right now, let's focus on the dynamic range indicator. The previous slide showed 3-bar color range indicator. We expanded this to 7 segments because we feel it's important within the in-range zone to also explain to patients when they're getting near a low or near a high, so that they can consider the context of why that might have happened or take evasive action. Clearly, we want to have patients avoiding true lows and highs. Yeah, there are many screens here, and thankfully not all of these appear to the patient one after the other. They really appear personalized to the patient based upon the current blood glucose value. So this Vario Reflect meter is providing a variety of screens, delivering in-the-moment guidance and also encouragement. On this panel here, we see guidance on high blood glucoses, and also here we can see how they're demonstrated and displayed to the patient for low blood glucose values. And there are other screens besides. And also this one's particularly helpful for looking back over data. In this case, 30 days, but you can go up to 90 days as well. It is very important between visits that patients are encouraged by the effort that they're putting into the testing themselves. So we have a number of rewarding messages with insightful information, such as explaining to patients when they have got back into range after a series of tests, or aggregating to demonstrate how many tests have been in range. In the Ascend study here, patients with type 1 and type 2 diabetes We demonstrated patients were more willing to act on blood glucose results when results were shown with the additional context and guidance of these various blood sugar mentor screens that you saw on the previous slide. As one example here, 71% of the participants said they would be more willing to adjust insulin based on high results after viewing the types of screens that the OneTouch Verio provided. And there was similar feedback for providing context to low results above and beyond just a numerical result. So with that background, let's look at the study itself that was recently published in the Journal of Diabetes Science and Technology. And my co-author here was Deborah Greenwood, who was past president of the American Association of Diabetes Educators. The title of the study being Healthcare Professional Perceptions of Blood Glucose Meter Features that Support the Achievement of Self-Management Goals recommended by clinical practice guidelines. And that's an important point. We want to embed the study in clinical practice guidelines. Now, glucose meters remain an effective tool for self-monitoring, but our belief is that not all meters provide the same level of insight. And this study was to investigate healthcare professional perception of 4 meters in particular and how they support achievement of the self-management goals recommended by these diabetes guidelines. And we enlisted the support of 3 recognized experts in diabetes management, Dr. Juan Freyes, Christy Beatson, and Deborah Greenwood, who was the co-author with me on the paper. Our 3 clinical experts selected statements from guidance that best defined how self-monitoring can support patients and healthcare professionals. And we looked at these 3 guidance documents to choose statements that were relevant or most relevant to self-monitoring and what a glucose meter could provide to deliver on those statements. In the end, 8 statements were selected as the basis upon which 4 BGMs could be evaluated in terms of their clinical utility. Here are the 8 statements. I will not read them out. If you've read the guidance documents, you'll be familiar, but they tackle areas such as allowing glycemic targets to be individualized, explaining hypoglycemia or impending hypoglycemia, optimal use of self-monitoring requiring proper review and interpretation of data. So we covered the real gamut of areas that would be important that a glucose monitor might be able to support. So how did we demonstrate this to the healthcare professionals who took part in the study? The HCPs viewed interactive web pages showing how each BGM displayed self-monitoring insights relevant to each clinical statement. So you can see here meter A, B, C, and D. And we took the visuals from the quick start guides or the owner's books of each of these different meters. And some meters have more or less insight, and that's why there are more or less graphs representing. So this statement here says, which meter displays self-monitoring information in the best way to allow patients to track progress of glycemic targets? We had another question, there were 13 questions in total. Which meter provides the best feedback and insight on low glucose data to help patients detect and know when to act upon hypoglycemia? And again, we showed at the same time a comparison of what each particular meter might provide. So this was done across the board, and HCPs were able to compare each of these BGMs in terms of their ability to deliver on each statement, and we asked them to rank each meter as the best or the least able to support. And a 1 was provided if it was the best meter, a 2, a 3, or a 4 if the healthcare professional felt, looking at the visuals, whether that meter least supported the statement. So the 4 meters that we had, meter A was the Accu-Check Guide, meter B is the Senzia Contour X1, meter C was the Abbott Freestyle Lite, and meter D was the OneTouch Verio Reflect. I don't think so far I've explained how many healthcare professionals we had. We had 353 healthcare professionals, 151 endos, 102 PCPs, and 100 diabetes nurses. And you can see here pictures of the meters A, B, C, and in the green was meter D. We had 5 countries that we covered with 70 healthcare professionals per country. So we had the US, Canada, France, Germany, Italy. Now this is a combination chart, and I'm just picking out two things. So for this question, which meter displays self-monitoring information in the best way to allow patients to track progress against glycemic targets? We see that 77% of the healthcare professionals chose meter D, which was VarioReflect. We had far less choices made as top choice for the Freestyle Lite or the Contour Next One or the AccuCheck Guide. And this was the same structure for each of these questions asked, whether it was on hypoglycemia or on hyperglycemia and avoiding highs. And in question number 7 here, which meter provides the best tools to help patients on insulin therapy keep track of testing and to help motivate them to get back in range? Similar responses across the board and strong acceptance for VarioReflect. So we continued this journey throughout the study, comparing different meters and what they offer. Two other highlights would be question 9. Which meter provides the best insight to help patients make decisions about diabetes management? And I guess this really speaks to the variety of screens and the personalization possible through the blood sugar mentor and perhaps a little bit towards the dynamic range indicator, but this really speaks more to the blood sugar mentor. Which meter provides the most optimal features to help patients review and interpret data? Again, there are collections of screens which enable bar charts to be provided, which look back across data and such like. So again, the One-Touch VarioReflect was chosen across the board here as the top choice by at least 7 or 8 out of the healthcare professionals from the 5 countries. In a final survey, we asked some closing questions. Again, meter D, the VarioReflect was chosen unanimously for a number of these statements. I'll pick out a few. For example, being the best meter for patients with type 1 diabetes or type 2 diabetes, or also the best meter to help patients stay engaged in diabetes management. And again, the blood sugar mentor strives to provide that encouragement and motivational messages to patient, as well as asking them to watch out for certain glucose values. And I didn't show any of the goal tracking or award type selections that patients could include in these screens during setup, but there are many screens available, and I can see this has resonated with the participants in the study. So, in conclusion, healthcare professionals chose the One-Touch VarioReflect meter as the best BGM for patients with diabetes, the best BGM to help patients improve diabetes management, and also the best BGM to help patients stay in range. And with that, I will close there and thank you very much for your time. Thank you.
Thank you, Dr. Grady, for sharing the study with us today on healthcare professionals' perceptions on blood glucose meters. Hello, everyone. My name is Julie Devlin with LifeScan. I'm a practicing registered nurse and diabetes nurse educator based in Vancouver with 25 years of experience in adult practice. I am very pleased today to introduce Dr. Robin Conway, who will help us today to discuss the study findings. Dr. Conway is Medical Director of the Diabetes Clinic in Smith Falls, Ontario, and Research Director of the Canadian Centre for Research on Diabetes. He has worked exclusively in diabetes for the past 35 years and has a wealth of experience with people with diabetes, type 1s, type 2s, gestationals, pediatric, and adults. Over the course of his career, Dr. Conway has completed a number of research studies and has published many articles and abstracts related to diabetes. Thank you, Dr. Conway, for allowing us to learn from your practice and research.
Thank you. It's a pleasure to be here.
Great. When the study was published, we organically discovered you were actually one of the physicians surveyed in the study. Is this correct?
Yes.
Yeah. Well, thank you for that participation. When we look at blood glucose monitoring, it's an integral part of diabetes management. Can you share in general your thoughts about the importance of blood glucose monitoring?
We know that a lot of the complications of diabetes are directly related to blood glucose levels. So the control of glucose levels is absolutely vital in decreasing the complications of diabetes. So knowledge of blood glucose is critical. The guidelines show us that virtually everybody with diabetes should be doing some form of glucose monitoring. So glucose monitoring becomes a vital part of every diabetic's treatment.
Well, thank you for that. It's so important. Can you tell me a little bit about your thoughts on what is important in a blood glucose meter, or what makes a blood glucose meter great?
Again, the guidelines are very patient-centered. The most important thing is what works for the patient, to be able to gather the appropriate information. And so it may be different for each patient. To me, at the first stages, when we start monitoring, the critical thing is simplicity. We want a meter that is very, very simple, that you can't go wrong. It'll be needed for a variety of patients. And we should be able to do a finger prick, put a blood sample onto a stick and get a result. We shouldn't have a lot of buttons to push. We shouldn't have codes to enter beforehand. And the one-touch variable reflect does this very well. That we can start with the simplest of things. It's a simple meter to use. Doesn't matter even whether you can read or write, you can still use it. But the beauty of the meter is how you can expand this to give yourself more insight as time goes on and more complex monitoring is needed.
Thank you. That was very interesting. I heard you say a couple of interesting things, that blood glucose monitoring needs to be individualized to the patient, needs to be simple, but you do like that there's added value in actually the one-touch variable reflect meter in that it provides some additional insight. Can you tell me a little bit more about that insight that can help a person manage their diabetes?
As I said, the meter is very basic and simple. They don't get simpler than that. It conforms with the most advanced standards of nowadays as far as accuracy is concerned. However, once you get past the ability to get a glucose level, it can give you an amazing amount of insight, because every time that you do a blood glucose, you get a visual indication of whether that glucose is high in the normal range or low. Okay. And so whether interventions are needed.
Thank you for sharing that. That's very interesting. Do you have patients that come into your office and they may say to you, Dr. Conway, what meter do you recommend? What is the best meter out there?
Correct. Everybody's needs are different, and that some people need special things. People who have visual impairment may need a meter that talks to them. People who have difficulty seeing things may need a particular meter that has a large strip or something like that. Mm-hmm. But generally speaking, the variable reflect meter has, number one, an accurate system. Number two, a very simple system. And number three, it has the feedback to allow the patient to develop the insight needed. Most patients initially don't really know what a high variable glucose is. This meter, every time you take your glucose, it shows you a colored scale at the bottom of the meter that shows whether you're high, normal, or low. And you can then go on from there and get things more and more, I don't know whether complicated is the right word, but you can build in more feedback, prove insight, and get some form of coaching on what we might have done or might have thought of to avoid the highs or avoid the lows.
You know, I find that very interesting. Self-management is such an important part of diabetes. And we know that your patients can't sit in your office all day and ask you questions. They have to actually go home and manage their diabetes. So being motivated and supported to manage their own diabetes by getting some additional nudges, we might say, or some additional insight can be really important. Do you have any examples of how this has happened in your practice where you've seen people get motivated or energized by some of these insights they get?
I do. I've got a story with you, but while I think of it, let me start out by saying that we're in different times right now. We're in tough times. We're in the times of COVID. And the way that we practice has largely changed. You and I aren't sitting in front of each other.
No, we're not.
We'd be 6 feet apart and we'd be wearing masks. We're doing a lot of things remotely. Leader to help with this process of improving glucose control and giving insight is very important. Now, changing over to what you're mentioning is as the sort of stories. This has happened to me recently with 2 patients, and it was quite interesting. I saw 2 patients who were gestational diabetics. That is, they had diabetes in pregnancy, not before their pregnancy. And for the well-being of the fetus and the mother, it's essential to have very, very tight glucose control. Both of these women had very high post-meal glucoses, and I was absolutely sure they were both going to need mealtime insulin. So we had started them both monitoring, and because of the fact that I wanted more information from them, I asked them to use the one-touch variable reflect meter. The interesting thing was that when I saw both of these people back a couple of weeks later, all their glucoses were normal. They had no weight gain, and the post-meal glucoses, which had been quite elevated, were now normal because they'd realized what was causing it. It was largely diet and exercise. Both of them had started to do a little more exercise, and they were able to see on the meter what the effect of this was, and they had made adjustments to the diet. So the ability to see the information, to get a little guidance, is very, very helpful.
Great, thank you for that great example. In the study itself, we did have there was an interesting question in it, and it was, which meter provides the best tool to help patients be aware of their near lows or near high test results so that they can take action? Why do you think this type of, what do you think of that question, and why do you think this is important?
It's important because we obviously want to avoid lows because of potentially very severe and catastrophic problems, and highs to prevent the complications. The meter gives you the insight that you are getting there, that you are too high or you're getting high. It will also give you suggestions for avoiding that, for reducing calorie intake, carbohydrate intake, and so on and so forth. Similarly with the lows, it warns you when you're getting there.
You know, I do like that. You know, it's a really good point you make when it says that it's near low. If I was about to get into a vehicle and I was to test and I was saying near low, I might do something differently than if I didn't get that. So, you know, sometimes that near low just is that extra nudge you know, if it just gave me a number, I might think I'm good. But if it gives me a little reminder, you know what, you're getting close to that low. Maybe I should have a snack here before I drive this vehicle.
The knowledge that you're getting to a poor range.
Mm-hmm. One of the things I noticed with the One Touch Very Reflect as well is that it will give a message if you are low to treat a low blood sugar reading. Treat your low blood sugar by taking juice. In your practice, have you found that patients sometimes could use that gentle reminder? Do your patients always, treat their lows, or does a reminder help them?
I think a reminder always helps. Both because sometimes we just don't take a lot of notice of what's going on, particularly if you just the number alone. Now, some nudge, it may not be enough, but the gentle nudge is helpful. And the other thing is that this is one of the most helpful things with this particular meter is the colors. That the colors on it give me the ability to remember things and to see where you're at. It shows you when you're high, when you're low, it shows you when you're getting low.
Yeah, thank you for that. You mentioned earlier that, working in a virtual environment now, in your practice. Now, I'm assuming that you have to make a lot more phone calls with your patients. Do you find the One-Touch Vero Reflect is beneficial in today's environment in communicating with your patients around blood glucose results?
Yes, it is. And the reason is that on the meter face, you can get basically a diary of where your glucoses have been. So it gives you the results one at a time, but it also gives you a virtual diary that you can look at. The other thing about it is that it can very easily, seamlessly transfer that data to your cell phone by using the Reveal application, which you can put on your cell phone. So you can get a very clear picture of that data. You can also send it to the doctor beforehand. And you can also, using the Reveal app, if you as a patient have an appointment with me tomorrow to review your glucoses, today we can download your glucoses to my office computer, and it can be there on the screen or printed out before I call you for your results. So I can have an idea of what's going on and be able to give you some worthwhile advice. Also, you can do it yourself or with the assistance of the physician. You can put in ranges. So you can have a normal pre-meal range. A normal pre-meal glucose is 4 to 7. Normal post-meal glucose may be up to 10. But again, it varies from person to person. So what happens is that we can put that in so that it'll tell us that for you, which may be different than high for me. Right. So we can put in the pre and post-meal ranges so that the advice we get is distinctive for you.
You mentioned the One-Touch Reveal. I really feel that you really captured well how it can help both you in your practice and help the patient get the most meaningful interaction. Without a good diary or a good set of results, it's really hard sometimes to make and help the patient make some decisions and support their decision making without those results. So it sounds like you've got a number of different ways they can send you results. You can actually use the HCP Reveal on your computer, and it sounds to me you could have really good interactions with your patients.
That's correct.
Yeah.
The main thing is that you can get the data that you need, that the patient can also get the insight and the advice without necessarily having to be in the office to get that. And I think that that's very helpful.
Well, thank you for that really valuable insight. As you know, there's been a lot of innovation in glucose monitoring, but the vast majority of patients continue to use blood glucose monitoring. What are your thoughts around the relevance of blood glucose monitoring today?
I think we've learned more and more how relevant blood glucose monitoring is, because we know that there are two types of complications of diabetes. We have the cardiovascular complications, which occur almost any time. elevated glucoses are not terribly responsive to glucose control and are largely controlled with the use of other medications. However, what will hurt you in diabetes are the microvascular, small blood vessel complications. One of these is diabetic kidney disease, and a huge number of people with diabetes end up with diabetic kidney disease. So, maintaining normal blood glucoses is absolutely critical. And as time goes on, and the amount of insulin makes it get smaller and smaller, it gets more and more difficult. So you start looking for more and more information from your glucose meter. So as I said before, with these meters, particularly with the varioreflect meter, the ultimate simplicity, prick your finger, get a number. It goes on, and we need more. We get the ability to see more and get more mentorship in how to control the glucoses to prevent complications.
Well, thank you for that. I liked how you mentioned that you get that little bit of mentorship, a little bit of coaching, a little bit of nudging here and there to help you make some decisions, especially when you're at home and you get a result. And sometimes you're not always sure what to do with that result when it is out of range. So getting that little mentorship can be very helpful. Well, thank you, Dr. Conway, for answering our questions today and taking your time. We have learned a ton from you, from your practice. It sounds like you've had some very good success. We have limited time today for our educational session. We'd like to continue learning from your research, and I look forward to our next conversation.
Thank you. It was a pleasure to talk to you.
And thank you again, Dr. Conway. And thank you, everyone, for joining us today. Have a great day.